Our next presentation will be given by Professor Silber from the Heart Center at the ISER in Munich, and he will provide us with more information about what can be the future of the duration of dual antiplatelet therapy.
Thank you, Flavio. After Alexandre talked about the past and Azim talked about the present, it is my task to talk about the future of dual antiplatelet therapy, especially the duration of dual antiplatelet therapy. We all know from clinical circumstances that there are situations where we have to discontinue the duration of dual antiplatelet therapy even before the lower limit of the recommendations of the guidelines. So the question is, what happens if this occurs? Interestingly, about exactly 1 year ago at the EuroPCR last year in Paris, for the first time there were data presented for the everolimus-eluting science stent. What happens if the dual antiplatelet therapy has to be discontinued even before the 3 months and after the 3 months after stent implantation? And as you can see here from this figure, there's a huge difference in the stent thrombosis, because if you discontinue within the first 3 months, there is almost double high stent thrombosis rate than compared discontinuing after the 3 months. If we look more detailed, and this data has been presented last year at the TCT, this is the 2-year follow-up, and as you can see, there's a highly increased stent thrombosis rate if you discontinue between day 0 and the end of the first month. But this significance stays up to about 6 months. So after 6 months, it is safer to discontinue the dual antiplatelet therapy. Well, this was a nice, actually a nice start for us to look at our database with the sotarolimos-eluting Resolute stent, and we did a similar analysis based on the same observations that sometimes you have to interrupt the DAPT duration unplanned much earlier. So we did a post-hoc analysis of the Resolute stent, which I call a newer generation. You can call it second or third or whatever, newer generation drug-eluting stent. So here's the flow chart of the analysis. Actually, this was a post-hoc analysis of several international trials, but the good thing is that the inclusion criteria and the adjudication process was very similar. If you look at the lower part of the figure, you can see that in over 4,000 patients, they never interrupted within 1 year, whereas in over 1,000 patients, the dual antiplatelet therapy was interrupted within the first year. And what we did then, we separated the first month versus the rest of the year, of the first year after stent implantation. And as you can see, 182 patients interrupted within the first month, whereas over 900 patients in dual antiplatelet therapy between the first and the 12th month after stent implantation. The next figure shows you in yellow those who temporarily interrupted, and as you can see very nicely, it's around 5%, and the average 5%. That means that about 5% of these patients had interrupted dual antiplatelet therapy because of going to the dentist or having minor surgery. But the majority of these patients interrupted for longer than 2 weeks. So let's focus now what happens to the patients who have interrupted dual antiplatelet therapy for more than 2 weeks after stent implantation at different time intervals. Well, this is, of course, a lot of information. You can read it, interestingly, you can read it alone, but just look at the first line. The only major difference between this group was the age, and the age difference was about 1 or 2 years. So overall, although it's a post-hoc analysis, I think the groups were rather good comparable. Well, this is the first results, which is a very striking result. As you can see, as we knew from the previous studies presented, by interrupting dual antiplatelet therapy, this is the upper curve, within the first month after stent implantation is rather dangerous. You have a stent thrombosis rate of over 5%. But if you look at those patients who never interrupted and those patients who interrupted after 1 month, This is astounding. There is no difference in stent thrombosis rate, and even in those patients interrupting after 1 month, at least in these about 5,000 patients, we had a 0% stent thrombosis rate. Of course, this might be statistical coincidence, but it's very, very low. If you look at the next figure, you see a similar drawing regarding cardiac death and target vessel MI. As you know, stent thrombosis is related to these parameters, and this curve shows about the same thing, that discontinuing the dual antiplatelet therapy between 1 month and 12 months after stent implantation is related to a unexpectedly very low risk of these severe events. Well, of course, this is a post-hoc analysis with a lot of strength, but also limitations. The strength is that the data were really very well monitored, and they had very, very comparable inclusion-exclusion criteria, clinical event committees, and so on. Of course, the limitation is the same as with all post-hoc analyses, that the sample size is limited, and of course, a randomized trial would be better, but this is the data we have. There's no randomized trial so far looking at this. So the conclusion of this analysis, of course, is not to change the guidelines. This is, I think, not enough proof to change the guidelines. But if for some reason an unplanned discontinuation of dual antiplatelet therapy has to be done for clinical reasons, I think it is much better, and the physician or we feel a little bit or much safer to do this, and also for the patient it is safer. So if for some reason we have to discontinue dual antiplatelet therapy, I think it is a lower risk with a newer generation stents. Well, what is the future bringing? Here's a list of those currently ongoing randomized trials looking at various durations of dual antiplatelet therapy. Azim has shown before the 3 already published trials with different duration of antiplatelet therapy. Here you can see that the DAPT study goes 12 versus 30 months. The eyes are safe goes 6 versus 12 months. The optimized trial goes 3 versus 12 months. The italic trial goes 6 versus 12 months, and the security trial investigates 6 versus 12 months. But I think what we actually really need would be a trial of 1 month versus 12 months, but I'm not sure if anybody will have the guts to do such a trial. Well, my task was to talk about the future, and I will show you this as the last slide. It's a nice quote from the famous Danish physicist Niels Bohr, and when he was asked to talk about the future, he says, "It is difficult to make predictions, especially about the future." Thank you.
Thank you.